When we're talking about the urinary tract, you can have kidney stones. You can also have bladder stones. But bladder stones tend to form for a different set of reasons.
Hmm. Dr. Kymora Scotland is a US-based urologist who specializes in endourology and stone disease, and she's also been collaborating with our team on patient-centered research. Thank you so much for sharing your expertise with us today.
Thank you so much for having me here.
Can you share a little bit more about your background and how you came to be interested in recurrent and chronic UTI?
Well, I'm a urologist, and during residency, I really started becoming interested in kidney stones. And so that is my primary area of interest. But one of the things that I noticed once I became an actual urologist is a lot of my patients were coming in with recurrent UTIs.
Hmm.
Sometimes they were sent in to me because they had kidney stones. And as I'm sure we'll talk about a little bit later, there can sometimes be a connection between the two. But, towards the end of my first few years working as a urologist, I started to notice that lots of patients, even without kidney stones, were coming to me with recurrent UTIs. And so it's really become an area of interest for me as well.
Well, that's good for us because there does seem to be quite a bit of crossover between kidney stones and UTI in our community. So we got a lot of questions. I wanted to start with some basics to get an overview. And the first one, of course, is what is a kidney stone?
Right. So a kidney stone is really what I try to call a collection of material. What tends to happen in all of our bodies is that our kidneys make urine, and that urine will have minerals and crystals. For people who form stones, what ends up happening is that those crystals will deposit
Hmm.
out of the urine into the kidney. And then as time goes on, more and more crystals will sort of pile up on each other and form a stone.
Right. Are there different types of stones?
There are five main types of stones. There are calcium-based stones, calcium oxide and calcium phosphate. There are uric acid stones.
Hmm.
There are cystine stones, struvite stones,
Hmm.
and then there are another mix of stones, which is sort of my fifth type, and those tend to be much more rare, and they can be caused by certain medications or certain
Hmm.
drugs that you might be taking.
What does the kidney stone look like?
Well, it really looks like a stone that you would see on the street, and that's
Hmm.
why it's called a kidney stone. They can be just as hard as a rock or a pebble that you see on the street as
Hmm.
well.
Sounds very uncomfortable. But how do each of those types that you mentioned form? Are they formed in different ways?
They are, and I should mention that most people will form calcium-based stones.
Hmm.
So, if you are a stone former and you go online, a lot of the information that you're going to see has to do with people who have calcium type stones.
Hmm.
But I'll start with the others first because they are a little bit less addressed online and in literature.
Right.
So, for instance, you've got uric acid stones, which tend to form for a variety of reasons. And I should say that that's the case for all stones. But for uric acid stones, they sometimes form because of certain illnesses that people have. And they can sometimes form because of the types of food that you eat. So I'll tell people that with uric acid stones, for instance, you tend to see a lot of folks with diabetes,
Hmm.
folks with obesity might have uric acid stones, folks who eat lots of meat. And when I say meat, I don't just mean red meat, I mean any type of meat product
Hmm.
can sometimes have uric acid stones. That's not exclusive, but those are some of the more common things that we see. For instance, with cystine stones, those are genetic. And so,
Hmm.
really, with people with cystine stones, they form them as kids. There's nothing that you have done or can do necessarily to avoid cystine stones, and they're the type of stones that we really have to work with patients, and you'll tend to find lots of family members with those stones.
Hmm.
Struvite stones, which I'm sure we'll talk about a lot more later, are also known as infectious stones, and those stones are formed from bacteria.
Hmm.
Then you've got the calcium-based stones, as I mentioned, and those can be formed for any number of reasons. Sometimes we can find reasons associated with diet, for instance, whether or not you're drinking enough water.
Mm-hmm.
And I should mention here that with almost any stone that you can form, if you stay hydrated, that's going to get you a long way towards preventing stones because hydration is one of the things that we found is really associated with stone formation.
Okay. How big can kidney stones get?
So they can be anywhere from a small pebble or, what you call a punctate stone. So for those people who've had stones, if you get ultrasounds done or CAT scans done and the physician tells you the report result, you might see that you have a punctate stone, and that just means it's a pinpoint.
Mm-hmm.
And it can go anywhere from that size to filling the entire kidney. So you're talking 5-6 centimeters,
Mm-hmm.
which again doesn't sound like much, but your kidney's not that large.
When the stones form, do they stay in the kidney or can they move elsewhere in the urinary tract?
So they can do both. I have lots of patients who have had kidney stones for years. So lots of folks will have just one stone and they've had it hasn't gotten any larger. It's been
Mm-hmm.
10, 15 years and it just sort of stays in the kidney. But every now and then, and for some people more often than that, kidney stones will decide to fall out of the kidney. And what happens in that case is then they get stuck in the ureter. The
Mm-hmm.
ureter is the tube that the kidney drains urine out of, and it connects into the bladder. So a lot of times when people will tell you they have a kidney stone pain or they're passing a kidney stone, that stone has already left the kidney. It's stuck in the ureter, and that's what's causing all the pain.
In that case, does it often pass on its own or is some kind of intervention needed?
It really depends on the size. So, what I tell my patients is that most stones that are about 5 millimeters or less will pass.
Mm-hmm.
Once you get past that size, the chances of them passing on their own really starts to decrease. And then even when, you have smaller stones, it's not always a guarantee that you'll pass it. I've had lots of patients with 2 millimeter and 3 millimeter stones which don't pass.
Mm-hmm.
So it really sometimes is hard to predict. But generally speaking, the smaller the stone, the more of a chance that it will pass.
Okay. And when you do form kidney stones, do they tend to form in both kidneys at the same time or just one or the other?
That's not necessarily the case. I have lots of patients who will only have stones in one kidney.
Mm-hmm.
We're not quite sure why that happens. We think it's something to do with, because, each kidney is a little bit different. And
Mm-hmm.
so we think it's something to do with, how much crystal is forming in one kidney versus the other, but we're not quite sure. I have lots of patients who have what we call bilateral stones, so stones on both sides, and it's hard to predict what will happen.
Right. Do stones form anywhere else in the urinary tract or do they always originate in the kidneys?
So there are different types of stones. And when we're talking about the urinary tract, you can have kidney stones. You can also have bladder stones. But bladder stones tend to form for a different set of reasons.
Mm-hmm.
Generally speaking, bladder stones will form if there is something obstructing the bladder.
Right.
So what I tell most of my patients is your bladder is kind of a ball of muscle. Think of it like a balloon. It fills up and then it will, or it should, push the urine out once
Mm-hmm.
it's full enough. If you've got something blocking the bladder, or if you've got something that's causing the bladder not to be able to contract as well as it should, sometimes urine starts building up. When urine builds up, you have sediment building up, it causes bladder stones. So
Mm-hmm.
that's really very different from kidney stones. But one of the things that we've noticed is that people who do have bladder stones, those can get infected as well, because if you've got
Okay.
sediment, piling up in the bladder, you can also have bacteria sitting in the bladder. And sometimes those stones can be infected and cause UTIs.
Okay. So how common are kidney stones? What percentage of people do you think have kidney stones?
Well, they're quite common. And what we found is that globally, about 12% of people form kidney stones. If you think about it,
Okay.
that's millions and millions of
Yeah,
people.
that's a lot. So I guess it's not surprising there's so many people in our community that say they have kidney stones as well then. So given there are different types of kidney stones, are there common causes? You mentioned dehydration is a common cause. Are there other things that can lead to any type of stone?
There can be. So, like I said, there are some genetic issues that can cause stones, like cystine stones, and there are some calcium-based stones that can be caused because of genetics as
Mm-hmm.
well. But then there are certain things like diseases, like I said, diabetes.
Mm-hmm.
Some folks have bowel disorders like Crohn's and IBD. What those things can do is really pull fluid away from you, and
Mm-hmm.
dehydration is really one of the reasons why we think these types of stones form. So even if you've got these diseases, it's not really the disease that's the problem, it's the lack of water and the lack of being able to hold on to water.
Mm-hmm.
There are some things that we think can also cause kidney stones. Like I said, eating, excessive amounts of meat, but it can be also as simple as eating foods that are really good for you that happen to have oxalate. And oxalate is something that unfortunately is found in quite healthy foods like
Mm-hmm.
spinach and nuts and berries. And so sometimes people are, doing the best that they can, trying to eat healthy foods, and, they're causing calcium oxalate stones, for instance. So there are a variety of reasons, and what we will do is, work with the individual patient to try to figure out what might be causing their specific stones.
Is it a predisposition to oxalate issue? So not everybody needs to avoid eating spinach, or is this something that everybody should think about?
No, it really isn't, because again, like I said, oxalate is found in really healthy foods, and
Mm-hmm.
these are things we want folks to eat. And even some patients who have calcium oxalate stones may not be forming them because they're eating excess
Mm-hmm.
oxalate. And so that's one of the things that I want people to learn from this, because I think if you've got kidney stones and you go online, there's a lot of focus on oxalate.
Yeah.
But I should mention one, like I said, that just because you're eating oxalate heavy foods doesn't necessarily mean that that's what's causing your stones. And even with people who have high oxalate, you know, all of your oxalate doesn't necessarily come from your diet.
Mm-hmm.
Your body makes oxalate as well. And so, even in those cases where you're trying to cut back on your oxalate, it may still be an issue. So, what I
Okay.
would say is, talk to your doctor, try to figure out why you're forming stones. There are different things that we can do to help you figure that out. And then work on stone prevention based on that.
Okay, that's good to know because there is a lot of discussion about oxalates in our community as well and whether they should be avoided for everybody that has a UTI problem, but it sounds like that's not the answer. We got a lot of questions about risk factors for kidney stones, and you've covered some of them. Is there a difference between male and female biological sex in risk for kidney stones?
So there had been, up until the last couple of decades, it really was very skewed towards males.
Hmm.
And what we've noticed, though, in the last couple of decades, as I said, is that that's getting closer to 50%,
Okay.
especially in the US. And so I suspect that, in the next decade or two, we will notice a lot of parity. We're seeing more and more women coming in with kidney stones.
Do you have any theories about why that's changed?
We think some of it has to do with changes in diet,
Hmm.
and potentially some of it has to do with the fact that we do see that it's getting a little bit warmer. We're seeing lots more dehydration. People are drinking less water than they used to. People are
Hmm.
drinking a lot more sodas and things with lots of sugar and things that are not necessarily helping with your hydration.
Okay. So a lot of it comes back to hydration, it seems like.
Really does. I'll be using that word a lot.
Yeah. Well, some of the other potential risk factors people raise are whether perimenopause or menopause or HRT might have an impact on kidney stone formation.
We haven't really seen that.
Okay.
No.
And what about other hormones in the body? People mention stress hormones like cortisol.
Again, there's not really very much data to support that. There are lots of folks, including myself, actively doing research trying to figure out how kidney stones form and why they
Hmm.
form. But there's not been any real strong data in support of any hormonal changes necessarily causing stones.
Okay. And the last ones on that topic were whether your urine pH might impact the formation of stones or whether this is related, supplements that are designed to alkalize the urine, whether that also could be an issue.
So I will say that there can be a connection with your pH and stones. But
Hmm.
what we see, so for instance, with folks who have uric acid stones, what we see is that they tend to have much more acidic urine.
Hmm.
Okay. And in fact, I should mention uric acid stones are the only type of stones that you can dissolve with medication. And that's primarily because if you try to alkalinize your urine, then those stones will dissolve.
Okay.
Uh, with respect to other types of stones, there are some types of diseases and disorders that are associated with changes in pH, and they can form certain types of stones. So, for instance, calcium phosphate stones can sometimes be seen in a specific type of disease that's associated with a higher pH, so more alkaline pH. And so it really depends on the type of stone you've got. What are some of the issues going on with you specifically health wise that can cause stones? The other question that you really asked was about alkalinizing your
Hmm.
urine. And I know there's lots of talk about alkaline water these days.
Yeah.
I think what is important is drinking water.
Okay.
Alkaline water hasn't really been shown to make a difference for most people with kidney stones. Again,
Okay.
because there are different reasons why stones can form. And there's not really any data to show that the alkaline water doesn't just, neutralize in the stomach, which, as we know,
Mhm.
is acidic.
Right.
So, my advice for people is just drink lots of water. I don't care what kind of water you drink, as long as you're drinking water.
Got it. The other question on possible risk factors was around long-term antibiotics or long-term Hiprex and whether either of those things might be associated with kidney stones.
So there's not really any data about Hiprex,
Okay.
but I should say that there's some emerging data about antibiotics. There are a couple of papers that have been published in the last few years now showing a connection between previous antibiotic use and kidney stone formation. One
Hmm.
paper in particular was done in the UK because you've got the NHS and you've got all this data, thankfully, and these scientists were able to show that in pediatric patients, so in kids who were given antibiotics, within months to a year afterwards, there was an increase in the rate of kidney stone formation. Now, again, like I
Interesting.
said, this is emerging data, and as of right now, it's just an association. We
Hmm.
haven't had anybody yet prove, that there's a through line from antibiotics to stones, but certainly more and more data is showing that there might be some connection there.
Okay, that's interesting. And you mentioned earlier a type of stone that is caused by bacteria. Does that mean that long-term UTI also might increase the risk of kidney stones?
So it's sort of the other way around. And that stone is called a struvite stone. Those stones are really formed by the activity of specific types of bacteria.
Hmm.
I won't go into too much detail, but there are certain types of bacteria that can release a particular enzyme. And what that does is it causes these stones to really form on it very quickly. So you have that deposition that I was talking about earlier, where you have sediment forming. You can have that happen very, very quickly
Hmm.
because of the activity of those bacteria. And so they form stones. Because those stones now incorporate bacteria, all right, into themselves, they can be a source of infection.
Hmm.
So they can be a source of recurrent UTIs for patients. And so I do have, a small percentage of my patients coming into me because they have this history of struvite stones. And then the treatment in that case is you've got to get rid of the stones. What you tend to find is once you get rid of the stones and you try to, treat those patients for a certain amount of time with antibiotics, you can really help them in terms of their recurrent UTIs and their symptoms. There are some patients who do not have struvite stones,
Hmm.
who have other types of stones, calcium-based stones, that we may also find to be associated with bacteria.
Okay.
And in those cases, what you tend to find is those patients will come in with recurrent UTIs, and as their physicians try to work them up to figure out why they're forming these infections, you may have some imaging done, ultrasounds or CAT scans, and find the stones then.
Hmm.
That's where I started seeing most of my patients because those patients would then be sent to me. And sometimes what will happen is when we treat the stone, we will actually culture the stones to see if there's bacteria incorporated into the stone.
Right.
And once we see that, again, we think that potentially what's happening here is that this bacteria is really the source of infection. And so some of those patients, when we clear their stones, their UTIs go away. So the way that we tend to diagnose kidney stones primarily is with imaging.
Hmm.
either with an ultrasound or with a CT scan or CAT scan. I should mention here that the gold standard is the CAT scan. And I say that because, sometimes ultrasounds don't necessarily tell the truth about kidney stones. And what I mean by that is this: ultrasounds are excellent type of imaging, but they're not the best at picking up kidney stones. And so sometimes they'll miss stones, and sometimes they will call stones that aren't really there.
Right.
So the gold standard is CT scans, but that's primarily what we will do. Now you can do urinalysis and you can do some blood tests that might help you to get a sense of what's going on with the stones, but really it's imaging that will tell you, unless of course the patient has already passed the stone, then they have a history.
Right. Are there symptoms of kidney stones that people can look out for, or early warning signs that they might be beginning to form?
Absolutely. So as I mentioned earlier, there are folks who have kidney stones and they just sit there, they don't do anything. Lots of people are walking around with
Hmm.
kidney stones and have no idea. So generally, people will know they have kidney stones, unfortunately, when they start to cause pain.
Hmm.
In a very small percentage of people, you may have them passing stones that are not painful. So, say for instance, you've got a 2 millimeter stone, which is quite small, and you're able to pass it. You might see it when you urinate. Oh, what is that? And then
Hmm.
you realize that's a stone, or, that is very, very rare. Most people, unfortunately, will find out they have kidney stones when a stone has fallen into the ureter, and it really does cause excruciating pain. Lots of patients who have kidney stones will tell you it's the worst pain they've had. And so when you start to have pain that's sort of in the back, in the
Hmm.
area where we call the flank, and that's the area sort of right underneath the ribs, sometimes, radiating around to the side and coming towards the front of the abdomen. People will tell you that they have this, horrible pain. It could be a cramping pain, what we call colic, and that is the type of pain that's associated with kidney stones. But unfortunately, they can also present a little bit lower down in the abdomen as well. And that all depends on where the stone is in the ureter. So if you've got a stone that's stuck closer to the kidney, you might have pain up near the back, like I mentioned. But if
Hmm.
you've got a stone that's stuck right before you hit the bladder, you might have pain in the lower portion of your abdomen. And so it can sometimes be really tough to tell if that pain is a kidney stone or something else.
Okay. As the stone passes through the urinary tract, can it cause damage along the way?
It can cause a little bit of irritation. And so that's why sometimes people who have kidney stones will see blood in their urine
Hmm.
because the stones can, scratch the ureter, scratch the kidney, scratch the bladder when they fall in. And so you can see a little bit of blood in your urine. Generally speaking, after a patient has passed a stone, at least some weeks to months later, I will have an ultrasound done just because I want to make sure that all is well. Because the other thing that stones can do when they are stuck in the ureter is they can cause something called hydronephrosis.
Hmm.
Hydronephrosis is a swelling of the kidney. If you think about it, as I mentioned earlier, the kidneys form urine and then they drain that urine down the ureter to the bladder. If the ureter is stuck, then the kidney's still making urine. And so eventually what happens is that urine hits the stone, can't get past it, and so it backs up into the kidney. It causes it to swell. And that swelling we can see on ultrasounds and CAT scans. It's called hydronephrosis.
Hmm.
By the way, I should mention that that's part of the reason why people have that pain in their back. It's because the kidney is so swollen that it starts to stretch, and that stretching is what causes the pain.
Right. Okay. And you mentioned earlier that urine pH is not necessarily associated with kidney stone formation, but do kidney stones themselves change the pH of the urine?
So they can. Again, like I mentioned, with struvite stones, they can change the urine pH. Uric acid stones are associated with low pH, but they're not necessarily changing the pH of the urine. They are
Okay.
able to form because your urine is that acidic.
Right. That makes sense. So you've talked about the symptoms that you might have as you're passing a stone or as one is lodged somewhere in the urinary tract. Could a kidney stone just cause symptoms that feel like a normal UTI?
They sometimes can. And so what can happen, I should mention as well that, some of the other symptoms that people will have with kidney stones are, in addition to pain, nausea, vomiting. You can sometimes have chills. Um, And, in the case of an infected stone, you can also have fevers. And if
Hmm.
that's the case, you've got to go to the ER because that could be a sign that you have something called sepsis, and sepsis is an emergency. So if you know you have kidney stones, you're passing a kidney stone, but you're starting to have fevers and chills, you've got to contact your doctor or go to the emergency room.
Okay.
That being said, to answer your question, which was again, whether kidney stones can cause symptoms similar to UTIs, they can. I mentioned that kidney stones, they're moving from the kidney down the ureter, which is quite long. And so sometimes when you've got a stone that's stuck closer to the bladder,
Hmm.
you can have the symptoms of a UTI. You can have urgency, you can have frequency, you can even have burning with urination. And, some people, for men, you can have pain at the tip of the penis sometimes. All of this happens because the nerves in that area are, sort of connected. And it's really hard for your brain to tell exactly what's happening.
Hmm.
So you have a stone that's stuck in the ureter, close to the bladder. It's irritating the bladder, and your bladder doesn't quite know, why it's irritated. It just knows it's irritated. And so you can have a lot of the same symptoms that you would have with a UTI, but it's just because there's a stone stuck there, and it's causing discomfort.
Okay. In that case, does it make sense for people with ongoing UTI issues to be checked for kidney stones?
Absolutely. I think, most physicians, if they're taking care of a person who has recurrent UTIs, will at some point do at least an ultrasound to see what's going on.
And you mentioned that CT scans are the gold standard. Is it possible that stones could still be missed using that?
It's really unlikely. There are very, very rare stones that are a result of the specific drugs that people
Hmm.
take, specific medications that people take, and they cause kidney stones that cannot be picked up on CAT scans. Those medications are not used by many people, and in fact, they're sort of being used even less and less by the folks who have that indication. So hopefully it won't be an issue for very much longer. But yes,
Okay.
there are very rare cases in which that would be something to think about. And if you're taking those medications or you have those issues, it's something that certainly your urologist would be thinking about.
Okay. Are there currently any urine tests that can detect the presence of kidney stones, or is imaging always required?
There are urinary tests that can help you figure out what kind of stone you have to a very small degree. So again, I'll go back to this pH and uric acid stones issue, or struvite and pH. Um, there are no urine tests right now that are on the market that
Hmm.
can help you to figure this out. There is some work being done by some of my colleagues with a specific test that is a point of care urine test that can help. That can potentially, I should say, help with that in years to come. They're moving towards, making this a commercial venture. So, we'll see. Fingers crossed on that. But what we do use urinalysis for, and urine tests for, is to help to figure out why people form stones. So in
Hmm.
the case that you do form stones, especially if you're a recurrent stone former, you may talk to your doctor about doing something called a 24-hour urine,
Hmm.
which is exactly what it sounds like. You're going to be collecting your urine for a full 24 hours. And the reason for that is because we need that much information to help us to figure out why you specifically might be forming your stones. So it doesn't necessarily help diagnose the stones, but it can help in some patients to give us a better sense of what are the things we really need to be attacking in terms of preventing more stones.
Okay. And you also mentioned earlier that you'll test the stones to see if there's bacteria associated with them. Is that always done? And is it also done to see what type of stone has passed?
So it's not always done. I personally will routinely do stone cultures
Hmm.
because of, just anecdotally for me and for some of my colleagues, we've seen positive stones even in patients that we weren't expecting to see them. And
Hmm.
so I try to do it routinely. But most people, I think, will not necessarily do that unless there is, some evidence of recurrent UTIs with stones, then they'll check. But most people will primarily do what's called a stone analysis. So if you either pass a stone or you have surgery and we go in and take the stone out,
Hmm.
we'll send that stone off to analyze it so that we can get a sense of what kind of stone you form. Because, like I mentioned, there's different types of
Hmm.
stones, and it's hard to tell sometimes what kind of stone you have. So, my advice to anybody is if you're passing stones, if you've passed a kidney stone, try to capture it and then bring it in so that your doctor can get it analyzed.